Biotechnology innovators Ruatech are working with University of Waikato scientists to develop a sheep milk with enhanced immune protection against norovirus. The work has potential to add a lot of value to the sheep milk industry.
The idea of hyperimmune milk came about during lockdown. The government put out a call for innovative ideas to help with the pandemic, and staff from the University of Waikato and Ruakura Technologies came up with the novel idea of using smart antigens to produce hyperimmune milk. Nutraceuticals are pretty much functional foods. That is, foods that have a bioactivity attached to them. As well as being nutritious, they impart some form of biological effect on the body for the benefit of the person consuming it. We're running the other samples that we previously prepared for immunoglutinolysis.
All right.
The end product is envisioned to be a powdered product in the form of a sachet or a capsule. It'll be consumed and help with eliminating any virus or bacterial particles by the antibodies in the powder binding to the target pathogen. The product that we're after is in the first 3 days after lambing, and this is when the antibodies specific to our antigens are the highest in the milk. So after the lambs have had their feed from their mother, the ewes will be milked and the rest of the colostrum collected, and then that will be pulled and taken to the processing plant for drying.
So we're looking here at working this through in sheep with our antigens. We've just got some of the original data here from the proof of concept study that we did in the sheep, showing those antigens working really nicely.
I'm a structural biologist by training, so that means that I look at the three-dimensional shapes of proteins and try and understand how their structure, how that shape and space allows it to have the function that it does. And so in this particular program, we're really interested in the shape of the antigens, which we're then going to introduce into the sheep, and they're going to have an immune response. And so my job is to have a look at the antigens from the viruses and figure out which bits are going to be the most useful to use to cause the immune response in the sheep, which is then going to get their bodies to make the antibodies in the milk that's going to be the product that we're hoping to make. Norovirus is a gastric virus. It causes vomiting and diarrhea. It hospitalises a lot of people each year, particularly small kids, and leads to a huge loss in productivity from people having to take time off work. And importantly, there's not a vaccine against it at the moment. So the fact that it's a gastric virus and that the product we're looking to make is going to be something that's taken orally, that's going to be working in the stomach, we were thinking that this is a really good opportunity to make something that could be useful against this pathogen. So there's two parts to it. The first part is that when you're making an antigen, you're talking about finding a bit of the pathogen, in this case the virus, which would be what the immune system will see. So it's got to be something that's going to be exposed to the body. And so the first part is saying, okay, what part of the virus do we want to interfere with so that it can't replicate, so it can't continue infecting? So to take an example that people are probably quite familiar with, the spike protein in the SARS-CoV-2 virus, it's a little bit that sticks out of the surface of the virus, and people were using that as the antigen in the COVID vaccines because that's something that if you can block that, then the virus isn't going to be able to work. So I'm looking in norovirus at the structure of the outside of the virus and then trying to zoom in on the bits of that outer shell, which I think are going to be the most useful to block to be able to stop the virus from replicating. And so those parts are what goes into the first component of our smart antigen. The second thing we do is that we join that to another component, another protein subunit, which is then going to make the antigen even more effective. It's going to make it even better at giving an immune response in the sheep system, which is then going to supercharge the milk that they produce, making it full of the kind of antibodies that we want to have in the final product.
All right. Let's get this set up to run.
Hyperimmune milk is a natural milk product that's been enriched to have a population of antibodies that are specific against a particular pathogen. And so this is a technology that's been around for quite a few years, but we're taking a slightly different, more molecular approach to how we're eliciting and developing those antibodies in the milk. I'm a protein engineer and I also have some expertise in immunology, and my role is to design the part of our smart antigen and understand how it interacts with the immune system of the sheep in order to really try and raise those levels of bioactive antibodies. And the more bioactive antibodies we have in the product, the more effective it's going to be and the higher value we think that the product will be as well when we make it. We chose sheep because they're a really nice small ruminant animal that we can use for our trialling, but also because here in the Waikato there's a number of very innovative dairy providers who specialise in sheep milk who are really interested in looking for kind of the next value-added products to add to their portfolio. So it just made sense. We have capability and expertise here in the Waikato region to develop a technology like this. We see this as a way to value add to existing product streams. We're not doing anything out of the ordinary for like providing an animal vaccine. Animals get vaccinated all the time for various diseases, so we're developing one more that will improve specific types of antibodies in the milk, and we think that the technology will fit largely into all of the existing processing infrastructure downstream as well. And so for the farmer, we see it as kind of business as usual, but we would add an extra step on where we can elicit these really high levels of antibodies in the milk, or predominantly in colostrum as well. So we can take some of those milk products early on after birth, and we can formulate them into high value nutraceuticals.